Hello everyone, myself Dr. Deepa LG. I am here to simplify OBG. So let's make learnings quick and easy. So my first topic is PPH, that is postpartum hemorrhage. As we all know, it is the most common cause of maternal mortality and morbidity. It is defined as any blood loss more than 500 ml of bleeding after the vaginal delivery or more than 1000 ml after the cesarean delivery. So it is classified as primary PPH and secondary PPH. That is primary PPH which occurs within 24 hours. It is mainly due to atonic PPH. The secondary PPH which occurs between the 24 hours or within the 6 weeks after the delivery. It is mainly because of retained placenta. So let's talk about causes of PPH. So we have to remember 4 T's. That is first one is tone, which is most common, that corresponds to 80% of the PPH, that is atonic PPH. Next T is tissue, that is retained placenta. Then thrombin, and next is trauma to cervix, vagina or the perineum, which leads to excessive of bleeding. So atonic PPH, which is more commonly seen, it is mainly because of over distension of the uterus, that is mainly because of multigravida, twins or polyhydramnios, or it can be due to prolonged labor. So whenever uterus is over distended, it cannot contract properly. So as a result of that, when uterus cannot contract properly, the blood vessels cannot occlude, so hence leading to excessive of bleeding. So it can be due to over distension of the uterus, as I have already explained, and it can be due to uterine muscle relaxants such as magnesium sulfate or nifedipine or anesthetic drug like halothane. Postpartum hemorrhage is an emergency condition. So first step in always emergency condition is always to call for help, and at the same time you have to start the resuscitation of the patient and check for vitals. So next step comes to the identification of the cause, so which is the very important step. So as the full management differs. So as we all know, the most common type of PPH is atonic PPH, that includes the management of pharmacological method, mechanical method, surgical method, and the last comes to hysterectomy. So how to diagnose it as a atonic PPH? So we have to palpate the abdomen. So if you feel the hard globular mass like a ball, it means that uterus is contracted. If you are not feeling anything, so that might be a cause for atonic PPH. So okay, you felt hard globular mass, but still the patient is bleeding. So then you have to check for other causes. So it can be placental retained placenta inside, or it can be trauma to the cervix. So you have to do exploration of the cervix and the vagina. If everything is fine, then also she is bleeding, it can be a DIC or it can be some other coagulopathy. You have to treat accordingly. So let's talk about the atonic PPH. That is pharmacological method includes 4 drugs, that is oxytocin 20 units IV in the ringer lactate. We have to give it for 3 to 4 hours. Then is ergometrine, which is contraindicated in hypertension. Then is carboprost, that is PGF2 alpha, which is a uterine contracting drug. Then is misoprostol, that is PGE1. It is given 800 to 1000 microgram. Next step, if bleeding doesn't stop, then we have to go for next step, that is mechanical method, that is mechanical compression of the uterus by Buckley balloon tamponade or condom catheter. So if bleeding doesn't stop, then we have to go for the next step by putting the by surgical management, that is by putting the compression sutures. The named compression sutures are B-Lynch and Haemorrhage. Then next, if then also it doesn't control, then we have to go for stepwise devascularization, that is uterine artery ligation, then internal artery ligation. If still bleeding doesn't control, with the internal iliac artery ligation, to save the mother's life, we have to do the hysterectomy, that is removal of the uterus. So that's all about the PPH. Thank you. Keep learning, keep growing. Thank you.